Hi, everyone. My name is Tiffany.
My name is Gabriela.
My name is Jie Yi, and this is Jonathan, and he also advocates for sunscreen use.
And today we'll be discussing on the misconceptions and benefits of sunscreen. We will be looking at the importance of using sunscreen and using it as a preventative measure to avoid sun damage, as well as the myths associated with it. We will also be looking at the different types of UV rays that penetrate the skin and how these can be associated with skin cancer and sunburn, and the steps you should take if you do have a sunburn. We will discuss items you should look out for when purchasing a sunscreen over the counter. So for our learning objectives throughout this presentation, we will differentiate between the three types of UV radiation, examine different times of sunscreen and their makeup and benefits, and illustrate how to best protect yourself from the sun and discuss the misconceptions that surround sunscreen.
UV light is produced by the sun and artificial light sources such as tanning beds and is not visible to us. Because of this, many people do not realize the potential harm that UV light can cause. There are three types of UV radiation: UVC, UVB, and UVA. UVC is the most dangerous one. However, it is mostly absorbed by the atmosphere and thus very little of it actually reaches us. UVB is the second most potent type of UV radiation. It penetrates the top layer of the skin, making it the primary cause of sunburns. It is also responsible for skin cancers such as basal cell and squamous cell carcinoma, along with melanoma. UVB radiation causes delayed tanning, which is another reason as to why it is so dangerous to us. Many people refuse to put on sunscreen, with their reasoning behind the choice being a desire to tan quickly and more easily than they would when applying sunscreen, thus exposing themselves to sunburns and potential skin cancers. UVA is the least potent radiation, but it is the one that we are exposed to the most, constituting of about 95% of UV light that reaches the skin. This makes it dangerous, as many people tend to ignore the problems that it can cause. It pierces the skin most deeply and causes aging. Many people who put sunscreen on daily often don't do so when it is cloudy or when they won't be outside, as they believe the UV radiation cannot get to them. However, UVA rays penetrate clouds and car windows. So UV radiation induces both chronic and acute changes in the body. Protection against chronic diseases like different types of skin cancers is one of the main benefits of sunscreen. It can also help slow down signs of aging. Exposure to UV radiation is deemed as one of the major factors of photoaging. Repeated exposure to UV light leads to increased degradation of collagen, alteration of new collagen synthesis, elastin fibers, and other chronic signs of aging. Almost 80% of facial skin aging is attributed to UV exposure. Sunscreen can help protect against acute changes in the body as well as a result of UV light, such as sunburn, inflammation, and hyperpigmentation. So here we have some common sunscreen myths which we'll be debunking today. A common one is that sunscreen needs to only be applied once daily. This is not true. Sunscreen needs to be reapplied every 2 hours, as the UV radiation, sweat, and oils on our faces can cause it to break down. Another myth is that sunscreen is not needed in people of darker skin tone. This is simply not true and very harmful to believe, as it causes people with darker skin tone to believe that they are safe from the dangers of UV radiation, which is not true. Their darker skin tone could protect them against major sunburns, which people with light skin tone are often bound to experience. However, they can still get sunburns and experience other negative effects of UV light. Another misconception is that a small amount of sunscreen can protect the large area of skin. That's simply not true. To provide the best protection for your skin, you need to apply a generous amount of sunscreen in order to cover the skin that is being exposed to the sun. Another misconception is that sunscreen will prevent the body from absorbing vitamin D. Multiple studies have been conducted to see if people who regularly use sunscreen experience lower vitamin D levels than those who do not, and this has never been found to happen. This is mostly attributed to the fact that sunscreen cannot block 100% of UVB radiation, and so our bodies still produce vitamin D when exposed to it. Another myth is that makeup is enough to protect the face from the sun. Makeup is not a viable protection against UV radiation, as it does nothing to stop UV radiation from penetrating the skin. Many people often believe that applying makeup that has SPF in it is enough protection. However, it is not true. Most cosmetics have an SPF of 50 or 20, which is not enough to protect your skin. Another misconception is that sunscreen cannot be applied on top of makeup. Many people believe that sunscreen will cause their makeup to break down or not blend in if applied. This is simply not true, as sunscreen can easily be blended into your skin without disrupting the makeup that is applied. Another misconception is that you cannot tan while wearing sunscreen. Although sunscreen is effective, as we talked before, it cannot protect against 100% of UVB radiation. This means that it is possible to get a tan even when wearing sunscreen. Another very common misconception is that sunscreen is not necessary in the winter. This is very harmful, as sunscreen is incredibly necessary in the winter because UV radiation can penetrate through clouds and is present, even though we often believe it is not, as the sun is hidden by the clouds. It can also reflect off of the snow on a snowy day, which can directly hit your skin and further damage your skin.
So before we discuss the details on what we want to look for in sunscreen, first we want to figure out what type of sunscreen do we want to use. There are two types of sunscreens that are available: chemical and physical sunscreen. Chemical sunscreens are made from organic compounds that allow the penetration and the absorption of UV rays, and they transform it into heat and release it from the skin. While physical sunscreens, also known as mineral sunscreen, contains inorganic compounds that reflect and scatter and block the UV rays before they reach the skin's surface. Some examples of this include titanium dioxide and zinc oxide, which stay on top of the skin and deflect UV rays, while chemical ingredients such as avobenzone work by absorbing the UV and reducing the penetration. So when trying to determine which type of sunscreen you want to choose for yourself, some questions you may want to ask yourself is, what type of sunscreen are you interested in? Physical or chemical sunscreen? Some considerations when choosing a sunscreen could also include your skin sensitivity, your age, type of activity, preferences, such as selecting a sunscreen that may not have a white cast. Some children that are older than 6 months, you may want to select a physical sunscreen. And for those that have a high skin sensitivity, you also would want to choose a physical sunscreen as well. While individuals who do not want to see a white cast, you would rather opt out from a physical sunscreen and go with a chemical sunscreen, as those tend to be less apparent when it comes to the white cast. You also want to look out for the form of the sunscreen and the expiration dates, and making sure that you're still able to use the sunscreen. And if it is outdated, you would want to throw it away. Items you also want to look out for in the sunscreen is the SPF, if the sunscreen is broad spectrum, and making sure that it is located on the label and that the active ingredients match up with it as well. Also, we also want to look out for if the sunscreen is water resistant for any outdoor activities such as biking or swimming, and so that the sunscreen can continue to remain effective even if you are sweating or submerged in water.
On the sunscreen itself, it's important to look at the label as it is with all things you buy. The American Academy of Dermatology recommends using a sunscreen that says broad spectrum, which means that it protects the skin from UVA and UVB rays, and an SPF of 30 or higher. SPF is how well a sunscreen protects you from sunburn. More on SPF will be explained later. If a sunscreen label says sport, waterproof, or sweatproof, don't believe it because no sunscreen is. All sunscreen needs to be reapplied every 2 hours or after swimming or sweating. Instead, look to see if the label says water resistant or very water resistant for swimming and sweating. Water resistant means that it is effective for 40 minutes, and very water resistant means that it is effective for 80 minutes.
There are many dosage forms of sunscreen that are currently present. However, according to the recent FDA guidelines, sunscreen oils, lotions, creams, gels, butters, pastes, ointments, and wax sticks are recognized as safe and effective for use. The FDA has also approved spray sunscreens. However, it does mention that there is minimal potential risk for inhalation and flammability, and should be used with caution if using sprays. However, sprays should never be applied to your face and only on the body. It is important to read the directions for the sunscreen products, as depending on the product, the directions can vary. Sunscreens and other dosage forms, such as wipes, body washes, shampoos, and towelettes are not recommended as there's not enough data and research present on its effectiveness, and we would recommend avoiding those to use.
Chemical and physical sunscreens work in different ways, however, they are both effective. Chemical sunscreens absorb UV light like a sponge and transform UV light into a non-harmful wavelength, also known as infrared light. It takes time to absorb into the skin and contains a variety of chemical agents, such as oxybenzone, avobenzone, and others, which protect against UVA and UVB radiation. Chemical sunscreen is not messy. It is easier to apply than physical sunscreen and has a less apparent white sheen on the skin. Physical sunscreen works by reflecting or scattering UV light like a shield. It is not absorbed and works immediately upon application. Physical sunscreens contain zinc oxide or titanium oxide and protect against UVA and UVB radiation as well. They are photostable in UVA range and are safe to use in children older than 6 months of age. They are also less irritating than chemical sunscreens.
There are some common active ingredients in all sunscreen products, and of course, some are better than others. Here we have ingredients that protect from UVA, UVB, or both. The different colors signify if the chemical is GRACE or not. GRACE stands for generally recognized as safe and effective. This rule was proposed by the FDA in 2019. In green, we have those that are generally recognized as safe and effective, and in red, aminobenzoic acid, which along with one other chemical, cholamine salicyate, is recognized as not safe and effective. Blue means that there is insufficient data to determine if it is safe and effective or not. Zinc oxide and titanium dioxide are still considered GRACE, while all the other ones in blue, along with a few others, still need more data to determine their final status.
SPF, also known as sun protection factor, is the measurement that indicates how well and how long your sunscreen will protect you from UVB, but it does not measure UVA. The SPF is a multiplication of your skin sensitivity to sunburn and is calculated by 10 minutes to sunscreen times the SPF value. For example, within this presentation, you can see here that a sunscreen with a SPF of 30, it will take 300 minutes to sunburn. Sunscreens are available in a wide range of SPFs. However, when choosing a sunscreen, it is often assumed that the higher the SPF, the greater protection you will receive from the sunburn. However, that is not the case. The higher the SPF and the lower the SPF lasts about the same amount of time and should be reapplied every 2 hours. It is recommended to use a sunscreen with an SPF of at least 30 as it blocks 97% of the UVB rays. However, let's assume that you get a sunscreen with an SPF of 50. It will only block 98%, and an SPF of 100 will only block 99% of the UVB rays. There are no sunscreen that can block 100% of the sun's UVB rays. Therefore, even if you do select a higher SPF, this does not equate to a higher, more effective sunscreen, nor does it mean that you should wait 300 minutes or 500 minutes after to reapply. It is recommended to reapply every 2 hours.
Some common mistakes that people often make is applying sunscreen only once daily. Sunscreen needs to be reapplied every 2 hours to best protect the skin from the sun, as sweat, UV light, and other elements cause it to break down. Excuse me. Sunscreen should be reapplied more frequently if swimming or sweating. Another common mistake is choosing a sunscreen that has a low SPF. Sunscreen needs to have an SPF of 50 or higher to perform best and offer the best protection. However, SPF 30 can also be used. Anything lower than that, especially SPF 15, does not provide any substantial protection. A higher SPF allows for a longer time in the sun without experiencing burning. Another common mistake is using too little sunscreen. An even layer needs to be applied to every area of the skin that is being exposed to the sun. Too little sunscreen provides minimum or no protection. Many people also only apply sunscreen in the summer. This is harmful as UV radiation is present in the winter and all other seasons as well. It is especially dangerous on snowy days when the light reflects off of the snow. Relying only on sunscreen to protect against the sun is another problem, as UV light and other factors break down sunscreen. Sunscreen also doesn't protect against 100% of radiation, as we talked about. Using other protections such as sunglasses, hats, or shawls is the best option. In the case that someone does experience sunburn, these are the best steps to take to make sure that you protect the damaged skin and alleviate the pain. Taking frequent cool showers can help with the pain. Pat the skin right after coming out of the shower, making sure to leave a little water on your skin and apply a moisturizer right after to trap the water on the skin. This can help with dryness. Another thing that could help with dryness is using soothing gels such as aloe vera or soy-containing ones. Taking over-the-counter non-steroidal anti-inflammatory drugs such as ibuprofen to help reduce pain, fever, and swelling, as well as drinking a lot of water can also help, as sunburns tend to draw fluids to the surface and away from the body. Allow blisters to heal without touching or removing them. And lastly, protect the area that is burned from further exposure to light with tightly woven clothes that allow no light to penetrate to the burned skin.
So this wraps up the end of this presentation. I want to give a special thank you for Dr. Wong and the P4's Heather and Cameron for helping us with our presentation. Thank you for joining us, and please let us know if you have any questions.
Thank you.
Thank you.
And Jonathan also urges you to protect your skin from the sun.